Welcome to the deep dive. Today we're tackling a really common issue, particularly affecting girls, vulvovaginitis. We've got your detailed notes here, and the aim is really to give you a super clear, memorable rundown. What it is, why it happens, how it's managed.
Exactly. A focused revision session, if you like.
Yeah.
These notes cover it all: definition, causes, risk factors, the works. It's something you'll definitely encounter, so let's nail the essentials.
Okay, let's dive in definition first. What exactly is vulvovaginitis?
Simply put, it's inflammation or, infection of the outside bits in the vagina.
Right.
The key things to spot are itching, redness, maybe some swelling down there, and often an abnormal vaginal discharge.
Okay.
You could think IRSD, itching, redness, swelling, and discharge. That helps remember the main symptoms.
IRSD, nice. So what actually
Yeah.
triggers it? What are the causes?
Well, there are quite a few potential culprits. Infections are a big one: bacterial, fungal, like thrush, sometimes viral. Then you've got irritants, thinks, soaps, bubble baths, perfumes, that kind of thing.
Okay.
Hormonal changes can be a factor too.
Yeah.
And maybe surprisingly, sometimes poor hygiene or even a foreign body, like a little bit of trapped toilet paper.
Right, a foreign body. Hadn't thought of that.
Yeah. So maybe IIHFB for infections, irritants, hormones, foreign bodies, and poor hygiene, maybe.
IIHFB.
Yeah.
Okay, useful. Now, who's more likely to get this? Are there specific risk factors we should know?
Yes, definitely. A poor personal hygiene is probably top of the list.
Okay.
Also, wearing tight, non-breathable clothes can trap moisture and cause issues.
Right.
And while maybe less common in younger girls, sexual activity is a general risk factor. Then there are underlying conditions: diabetes, maybe a weakened immune system,
I see.
and even certain medications can play a role. So maybe PTSD, poor hygiene, tight clothes, sexual activity, underlying conditions, and drugs.
PIETE. Good one. Okay, so we know the risks, but what's actually happening, like biologically? The pathophysiology.
It really comes down to the balance of the normal vaginal flora, the good bacteria living there. If something disrupts that balance, that ecosystem, it can let harmful bugs, pathogens overgrow, or it could just be an inflammatory reaction to one of those irritants we mentioned. That imbalance is what causes the symptoms, like a garden getting overrun with weeds, sort of.
The ecosystem out of whack. Got it. So when someone comes in with these symptoms, how do you tell it apart from other things? What's the differential diagnosis?
Good question. You have to think about other possibilities. Yeast infections or thrush are very common mimics.
Right.
Bacterial vaginosis, less common perhaps in prepubertal girls, but still possible. For older girls, you'd consider STIs.
Okay.
It might even be an allergic reaction, maybe to a new soap or another skin condition affecting that area.
So lots to consider.
Yeah, maybe Yoka B-face, yeast infection, allergy, bacterial vaginosis, STI, skin condition.
Why? Right. How common is this, especially here in the UK, epidemiology-wise?
Oh, it's very common in the UK. Affects females of all ages, really. Specific stats are a bit limited, but it's definitely something you see a lot in GP clinics and PAIDs. A frequent flyer.
Right. Very common.
Yeah.
So what are the absolute key signs and symptoms to look for? The clinical features.
They really mirror what we said at the start. Itching, maybe burning, soreness around the vulva. Redness and swelling are typical too.
Okay.
And that abnormal vaginal discharge is often a big clue. Might smell different, look different in color or consistency. Some might also find it uncomfortable or even painful to wee. So IBSRDU: itching, burning, soreness, redness, swelling, discharge, urinary symptoms.
IBSRDU. Okay. And if those signs are present, what investigations are usually done?
Primarily, it's about a careful physical examination, looking at the symptoms, assessing the area.
Right.
You can do vaginal swabs for microscopy and culture, to find the exact bug. But honestly, it's often avoided, especially in young kids, unless it's really necessary or things aren't getting better.
Okay, so examination first.
Yeah. pH testing can sometimes give clues. And obviously, if there's any concern about STIs, you do specific tests for those. But examination is key. Swabs are selective.
Got it. So how is it generally managed in the UK then?
The main thing is to figure out the underlying cause and treat that.
Makes sense.
So if it's an infection, you use the right meds: antifungals for thrush, antibiotics for bacteria, potentially antivirals. But a huge part is education about good hygiene. Wiping front to back, avoiding harsh soaps or bubble baths, keeping the area clean and dry, and steering clear of known irritants. So treat the cause, teach good hygiene, tame the irritants.
Okay. And the outlook. What's the prognosis typically like?
Generally, it's really good with the right management. Most cases clear up pretty well.
That's reassuring.
Yeah. But some people do get recurrent episodes, or it becomes more chronic. In those cases, you might need to dig a bit deeper to find out why. Generally good, but watch for recurrence.
And finally, any potential complications if it's not managed properly? Are they common?
Thankfully, serious complications are pretty rare.
Good.
But, you could see recurrent infections, maybe chronic inflammation that just won't settle, or sometimes secondary skin infections if there's been a lot of scratching. Rare, but possible. Recurrence, chronic issues, skin problems.
Okay, that's a brilliant, really clear deep dive into vulvovaginitis. So key takeaways. Common inflammation, lots of causes, hygiene and avoiding irritants are vital, and the outlook's usually good.
Spot on. And remember, if symptoms persist or seem unusual, always best to get proper medical advice.
Definitely. So here's a final thought for you listening. We're surrounded by scented products, aren't we? What simple swaps in daily life might actually make a big difference in preventing this kind of irritation? Something to think about.
A very practical point indeed.
For more great resources to help you learn and revise for your exams, do check out pastmsri.com and also freemsra.com. Thanks for joining us on this deep dive.